So for easy understanding of this ethmoid bone, let's compare this table here to the ethmoid bone. So this table has a top and it has 2 feet on either side. Don't imagine 4 feet, rather there are just 2 feet on either side from which various projections will be seen later on. This tabletop can be compared to cribriform palate of ethmoid bone. This is also going to have certain perforations through which your olfactory nerves from your nasal mucosa are going to pass through and reach your brain. Under the table, if you can imagine it as a cavity, that's your nasal cavity. Separating your nasal cavity into right and left sides is a perpendicular plate of the ethmoid bone. Over top of the table, that is your cribriform palate, you have a projection that goes up and that is known as crista gully, and it is usually towards the posterior end of the table, not the anterior end. From the legs of your table, that is the lateral side of your nasal cavity, there are projections inside. These projections are superior nasal concave and middle nasal concave. Also, the legs, that is the labyrinth on either side, the legs of the table, they are not this simple. They have air cells. They are called ethmoid air cells. Ethmoid air cells are divided into anterior, middle, and posterior air cells. Now, on the upper end of the legs, on either sides, you have a very thin structure which forms the medial surface of your orbital floor. This is known as lamina pepraceae, papery like pepraceae, so you can remember it that way. It's very thin. To have a better understanding of this ethmoid bone, I would leave a link below and you guys should check it out. And this also can be compared to a threshold used by God Shiva. It's like a weapon. So the flat ends here are the cibriform palate. Now the upper projection is crista gully, but it's more towards posterior. This is just a comparison, not the exact structure of ethmoid, but it will help you retain this information for a long time. But the structure is not exactly, but almost like this. So either sides we have a superior and middle nasal concaves. Just imagine them projecting into your nasal cavity. There. And the center is a palate of perpendicular palate of ethmoid bone. And laterally on the upper end we have this lamina pepraceae, which forms the medial side of your orbit. So that's another structure we have to remember. It's papery like and delicate. Now let's review the structure with not so pretty diagram. So that's your cibriform palate. The crista gully is projecting up on the posterior end. On either sides you have these legs, right, which have some bumps projecting inside, like under the table. Those are perforations for your olfactory nerve. They carry information from your nasal mucosa to your brain, so ignore the diagram. On either sides you have a very thin lamina pepraceae. It is present laterally on the ethmoid bone, but that makes medial surface of your orbit. Now the upper bump is your superior nasal concave and the below one is middle nasal concave. Inferior nasal concave is a separate bone, and in the nasal cavity the perpendicular plate projects and divides into two halves. That's perpendicular plate of ethmoid bone. So what will form the medial part of your orbital cavity? It is lamina pepperaceae. Ethmoid bone is in middle, and on either side you have your beautiful eyes. So lamina pepperaceae, that is papery like thin structure of ethmoid bone, is going to form the medial side of your orbital cavity. So now we have a roof that is cribriform palate. I always forget the name, man. Anyway, that is cribriform palate, and projecting down from the center of cribriform palate, we have perpendicular palate of ethmoid bone. On either sides, that is lateral surface of the nasal cavity, we have the superior and middle nasal concha. Inferior nasal concha is a separate bone, and nasal cavity is also divided into two halves with not only just perpendicular palate, there is other one vomer and cartilage also. Another part of ethmoid bone is uncinate process. I really don't have a good understanding of this process. If anyone can give an explanation or leave a link below to understand it better, it will be helpful. Thanking you in advance. Your ethmoid bone has air cells. So these air cells are divided into anterior air cells, middle air cells, and posterior air cells or sinuses. The main purpose of these air cells is to lighten your bones of your head. That's one function. I'm so sorry, there is a lot of disturbance in my area. So we just want to lighten the bones of our skull. And the second function is it's going to resonate the voice that's produced by your larynx, the vocal cords. So the ethmoid sinus or air cells can be infected, and when there is infection in these air cells, this infection can actually spread to your eye. So the most common cause of orbital infections, if at all it's spread from a sinus, that's most commonly from ethmoid sinus. Thank you so much for watching, and if I make any mistakes, please let me know in the comments below. I'm in the same boat as you guys. I'm trying to learn and trying not to make any mistakes, but please excuse me if I make any mistakes. Thanking you so much and have a nice day.